Hi, I'm Matt Tarzan,
I'm Lucrecia Martinez.
and we are with IPM, Bay Area Pain and Wellness in Los Gatos, California.
Today we are going to be talking about acute versus chronic pain.
And how we manage both of those types of pain.
Hello, Lucrecia Martinez here. Question of the day. Does pain equal damage or does pain not equal damage? Now that's the question. This is probably one of the hardest questions to answer because in most cases we refer to pain as something has happened to my body, there is damage. So this is a trick question. In today's case, these are both true. Let's discuss. Pain equals damage when it is an acute injury. Pain does not equal damage when it is considered chronic. Okay, now let's get into this a little bit more. When you are in an acute injury, that's from the first day that you were injured up until about 6 months. Once it's considered chronic, it's usually between 6 and 9 months on. Okay, and we give these time frames for two different reasons. Number one, our bodies are wonderful things, you know. You can create life in a short 9 months, and our body can heal of most things in 6. You break your leg, you'll be casted, and in most cases it'll heal on its own, unless it needs surgical intervention, and then that's when you need help to heal. However, there are some tears and broken bones that can heal by themselves, usually within a 6-month period. Usually after the 6 months, most things have already healed on their own or have healed as much as they are going to. Okay? Within the 6 months, you're in the acute stage. What your doctors are looking to do is treat what is damaged. Okay? All treatment is headed there, so you are going to be taking maybe medications for either pain or inflammation. You might have injections. You might have surgery. You might visit a chiropractor or acute PT. Acute physical therapy is different than the therapy done in our functional restoration program or in the exercises that we will teach you going forward. Acute physical therapy is where somebody is laying their hands on you or providing treatment where you are connected to a machine, a TENS unit, ultrasound, paraffin wax, etc. So that's a little bit different. Let's see, acupuncture, what else is there? Anything that is focused on fixing what's damaged. Another thing that happens here is a lot of diagnostic. So MRI, EMG, X-ray, and these are all intended to see whether you are a surgical candidate, okay? Once your condition is chronic, then you can either keep treating it the same way, but the relief is only going to be temporary, or you can start looking at things a little bit differently. So what we are going to focus on in future videos and educational lectures is more on how to manage the pain. The pain is a problem. It's what limits you from continuing to progress physically or functionally. It limits you from going out with friends or family, and it keeps you isolated and at home, right? But what we're going to try to teach you is active ways to manage your pain using your own body, your own technique, so that you can become independent and in control of how to manage the pain.
Hi, Matt Tarzan here again. What I'm going to talk about now is how do we manage these different types of pain. Lucrecia sort of touched on how we manage acute pain. When you have that acute injury, you're going to go visit your doctor, right? You might get PT, we'll give you ultrasound, TENS unit, all these different things, these skin over, things like that. You might get some meds to manage the pain itself, or the inflammation that will also help manage the pain. You can see all different kinds of things. You might get immobilized, as she mentioned, with a casting or something like that, or even some sort of surgical intervention. All of these, as she mentioned, are meant to heal. They're intended to help the healing process and allow you to once you're completed your healing, to then continue on and be normal again, right? Well, once we've gotten to that chronic pain after those 6 to 9 months, now using those passive modalities I talked about there will only mask it. She mentioned that as well. Will only mask the pain for a little bit. It'll just be temporary. Too many times we hear someone say that I went to the chiropractor, I felt great, right up until I got to my car. Then it was all starting to come back. So yeah, you feel great temporarily, right? So with chronic pain, we have to use those active pain management modalities. One of the main ones we use is stretching. Stretching helps to relax muscles that have been overactive for a while. And that's kind of a key concept there. It's, do you want to stretch the muscle or do you want to activate the muscle? Because if your muscles are hurting because they've been stretching for so long, say you've been on a long car ride and your muscles between your shoulder blades are hurting because you've been here. Do I want to stretch those muscles? No, I don't. I actually want to activate those muscles because they've been stretched for so long. That's what you're getting a bit of a battle between some neuroreceptors in there who are trying to keep your muscles from getting injured. So you're going to actually stretch overactive muscles, and you are going to activate underactive muscles. So when you're stretching, think about that. What's hurting and what were you doing that created this pain increase? Was it something you were doing in your muscles or overactive stretching? Or were you doing something where you were in a stretch position for a long period? Let's activate those muscles. All right. Next thing we're going to do, let's do some meditation. When we talk about meditation, all we want to do is bring our mind to a neutral place. There are many, many ways of doing meditation. You can focus on the breath and just really focus on getting your breath into your belly. You can even feel it go through your nose into your lungs and fill up, and then slowly exhale. You can feel that and really focus on that, and that's an excellent way to meditate. There are several other ways which we can go into deeper in future videos, but things like looking at a tree and just staring at it and using just your vision to see that tree. Look at the leaves, look at the color of the bark, what kind of bark, how many branches actually have leaves. Really use your vision on that tree, and before you know it, you're really not thinking about anything else. All those other thoughts are out there, but they're allowing your mind and your body to relax a little bit. Exercise. Exercising helps your body improve and will help the pain go down. When you've had an injury and you've been out for a while, muscles atrophy, bone density decreases, your ligaments become weaker, and then you suddenly jump back in and start trying to exercise full, it's going to hurt. Those atrophied muscles hurt. That decreased bone density hurts to move. So if you just stop every time it hurts, all it's going to do is continue down that path, and you won't actually start to see the improvement in reducing that pain. So you want to exercise, you want to start at a low level and build up. And once you're at the chronic stage, you're kind of trying to build up your whole body, not just the injury site. You want to bring things back into balance. There are several other active methods that we can get into further. Laughing is a great endorphin release. Just several things that we can get into in future videos and really help you manage your pain better. So I want to quickly touch on massage. Everybody loves to go get a massage, but not everybody can afford a massage. Unfortunately, that's the part of people who come into our clinic and they keep asking us, well, when is somebody going to give me a massage? Well, that's when we hand them something like a Theracane or a lacrosse ball or something like that, and we show them, here's how you massage yourself. This way you can take care of yourself when you're all by yourself and you have a flare-up. So it's called myofascial release. And What we're talking about here in particular is self-myofascial release. So, we here at the clinic have this really cool tool called a Theracane. It looks like that. With this part, you can massage your back and really get into some of the tender spots. What we're trying to do is break up adhesions that are causing pain. We can use this Theracane, we can use a foam roll, we can use a lacrosse ball and lean up against the wall, but again, what we're trying to do is break up these adhesions. And I'll show you really quickly what is happening with those adhesions. So you have muscle fibers in your body. Whatever muscle group it is, the muscle fibers run in the same direction. There's a couple of things that can happen here. One, the muscle fascia that wraps not just the fibers and the fascicles and the whole muscle, but it's there, it can stick to not only the muscle here, it can stick to other muscle fibers, so that if you have now another muscle group up here, and these are stuck together because of the fascia sticking together, we then try and move this muscle and this muscle's not moving, you're going to get pain right here. And it can be pretty painful. So with this myofascial release, we can actually break that up. Another thing that can happen is because of an injury or because of several like low-level injuries, microscopic level injuries, maybe from working out excessively and never ever stretching or never doing a myofascial release, you can get some scar tissue buildup. And scar tissue builds up across the muscle fibers. And that, as you can probably see, will actually create a problem when this muscle tries to lengthen or shorten. Here at this point, it doesn't want to move. All you're doing is basically pulling a Band-Aid off really, really slowly, and it's a Band-Aid that's really, really stuck. So what we want to try and do is get that Band-Aid off quickly. So we're going to use a myofascial release technique to break up this scar tissue or break up this adhesion, and therefore reduce the amount of pain you're in. Well, that's it for today. Stay tuned for next week.
Next week, we are going to discuss stretching, strengthening, and myofascial release techniques for lumbar injuries.